My name is Martin Origa. I am a gynecological oncologist in the Uganda Cancer Institute. Cervical cancer has been found to be caused by a virus called HPV, which is the human papilloma virus. Its main mode of transmission is the sexual transmission, and the risk factors around it actually are around sexual behavior. Okay? The more sexual partners you have, the higher the chances of getting the bad type of virus. And it begins causing changes on the cervix over a long period of time, close to 12 to 15 years, before actually the actual cervix, before the actual cancer breaks out. So smoking tends to make the cells around the cervix a little weak. HIV in our setting is also commonly associated with cancer of the cervix, and that enables this virus gain entry and go into the deeper areas of the cervix and stay there longer. So the commonest symptoms that patients present with are vaginal bleeding, a bad smelling discharge, bleeding during sex, pain during sexual intercourse, what we call dyspareunia, lower abdominal pain. Fortunately, this cancer in its early stages has no symptoms. So we advise that after you've started sexual activity, especially at the age of 25 to 30, start coming in for screening, because that is when we can get the lesions. We call them pre-cancer, before the cancer is really broken out. It's still early. We can do so much. Until these herbal preparations are tested and certified by the National Drug Authority of Uganda, I wouldn't advise anyone to go for herbal preparations for treatment of cancer of the cervix. So we do know these high-risk types, the bad types. So around those bad types, we have been able to build a vaccine. And currently in Uganda, there is this vaccine. It is in the National Program of Immunization, and it mostly targets school-going girls between 9 to 12 years who are not yet sexually active. Any woman who is sexually active is at risk of cancer of the cervix. I can tell you that in Uganda, it's the leading cause of morbidity and mortality for women. It's much, much cheaper in terms of finances, socially, health-wise. It's cheaper to treat cancer at an early stage or before it has broken out than when it has come out. So prevention is my key message.